The Uninvited Patient Dr. Aris Thorne's diagnostic principle was simple. The body never lies. Data points: a slight tremor in a hand, a minute shift in a pupil's response, the specific gravity of a urine sample. These were the immutable truths from which he built his fortress of reputation. The London Clinic's youngest head of neurology was a man revered for his preternatural accuracy. So, when his own body began presenting him with false data, his first emotion was not fear, but profound professional offense. It began with a single, violent episode of vertigo in his office, the world tilting on its axis, as he reached for a patient's MRI. Then came the intermittent tinnitus, a high-frequency whine only in his left ear. Finally, the fine motor tremors in his dominant hand, visible only to him as he struggled to suture a minor cut after shaving. He ran every test on himself, discreetly using the clinic's after-hours resources. Blood panels, neural scans, vestibular assessments. All returned pristine. According to the data, he was the picture of neurological health. According to his reality, he was deteriorating. His initial hypothesis was a rare, presentation-perfect brainstem glioma evading imaging. His secondary, more unsettling hypothesis was psychosomatic. Both were shattered by a smell. One evening, working late, he caught it in his private washroom. The distinct, cloying scent of jasmine and bergamot. His wife Lena's signature perfume, Jasmine Sauvage. But Lena had been in Paris for a week at a design symposium. The bottle was on her vanity at home. The scent lingered in the air of his sterile office bathroom, an impossible phantom. The incongruity activated his diagnostic mind. A smell was a data point. An impossible smell was a contradiction that demanded resolution. He began a new kind of investigation, one where he was both physician and patient, detective and subject. He installed a discreet, motion-activated camera in his office, pointed at his desk and the door to his private facilities. He started logging every morsel of food and liquid, meticulously sourcing each ingredient. He examined his personal items. And on the third day, he found it. In the inner pocket of his white coat, the one he kept on a hook in his office, his fingers brushed a small, almost imperceptible irregularity in the seam. Using a scalpel, he slit the lining. Inside, nestled against the wall, was a thin, flexible polymer patch, no larger than a postage stamp. It was a sophisticated transdermal delivery system, its reservoir nearly empty. He isolated it in a sterile vial. Lab analysis, conducted by a disreputable, but discreet contact from his university days, revealed a complex cocktail. A low-dose ototoxic aminoglycoside to damage the inner ear, vertigo, tinnitus, a beta blocker to induce tremors, and a subtle neuroinhibitor to cause brain fog. The delivery was timed, microdosed to mimic a sporadic, degenerative condition. Someone was poisoning him. Professionally, exquisitely. Not to kill, but to discredit. To make the great diagnostician appear to be suffering from an undiagnosable, possibly hysterical, ailment. To force him to step down. The list of suspects was a short, brutal ledger. The board, who found his autonomy irritating. Possible, but blunt. A rival colleague. The method was too intimate, too sustained. It required access. Not just to the clinic, but to his coat, to his life. He thought of the perfume. Jasmine Sauvage. An olfactory signature, or a taunt. He reviewed the camera footage. 4 days, nothing but himself, pacing, working, staring at scans. Then, on the night the perfume appeared, he saw it. At 11:34 p.m., after Head left for the night, his office door opened. Not with a key, but with a master override code. The figure was backlit by the hallway light, but the silhouette was unmistakably female, willowy. She moved with a quiet, proprietary certainty. She didn't go to his desk. She went straight to the coat hook, performed a swift, practiced maneuver at the lining, and left. The whole intrusion lasted 47 seconds. The gait, the posture, the confident knowledge of the override code, it couldn't be anyone else. It was Olivia Finch, his proc. The brilliant, ambitious junior fellow he had mentored for 3 years, championed for promotions, invited to his home for dinners. She had access to his office, his trust, his coat. And she, he recalled with a sinking heart, was famously allergic to perfume. She never wore scent. Which meant the jasmine sauvage was a plant. A red herring aimed squarely at his wife, Lena. The betrayal was a surgical strike, precise and devastating. Olivia was orchestrating his downfall, while framing his wife for the crime. The motive was clear. His position. With him deemed unfit, Olivia, as his handpicked successor and the only one who understood his unique case, would be the natural interim, then permanent, replacement. Confrontation was out of the question. It would be his word against hers. He'd be the unstable, paranoid chief accusing his innocent proc. He needed her to confess. He needed to turn her own weapon against her. Aris Thorne began to construct a diagnosis for his would-be successor. He started subtly altering his behavior, but with a deliberate, calculated inconsistency. He would forget a key detail in a patient review with her present, then brilliantly recall it moments later. He staged a minor, observed stumble, then dismissed it with exaggerated nonchalance. He was performing the early stages of a controlled decline, one he knew she would be monitoring eagerly. He then planted the seed. In a private mentoring session, he let a mask of weary vulnerability slip. Olivia, these episodes they are worrying me. The board is asking questions. I may need to consider a medical leave. If it comes to that, you're the only one I trust to steer the department. He saw the hungry gleam in her eyes, quickly veiled by concern. The bait was set. Now, he needed the trap. He knew she would need to escalate, to cement his instability, before he could formally name her as his deputy-in-waiting. He fabricated a new, more severe symptom. Transient aphasia, an inability to recall common words. He documented it in a fake, encrypted digital journal he knew she had the skills to hack. He left his tablet, with a decoy password hint, unattended. He then prepared the finale. In his office, he replaced the poisoned coat with an identical one. In its lining, he placed a next-generation micropatch of his own design. This one did not deliver a drug. It was a powerful, subcutaneous microtransmitter that would adhere to the skin of anyone handling it, broadcasting a real-time location, and, more importantly, acting as a sensitive audio bug. He also prepared a single-use, fast-acting emetic agent in a vial labeled as a new, experimental vertigo medication. He placed it prominently in his desk drawer. He waited, watching the camera feed from home. 2 nights later, she returned. This time, she went to his desk first, opening the drawer, examining the vial. A small, triumphant smile touched her lips. She then moved to the coat. As her fingers sought the lining to replenish her poison, the microtransmitter adhered to her skin. The next day, Aris called an urgent, private meeting with Olivia and the clinic's director of ethics, a formidable former judge named Helen Cartwright. He did not accuse. He presented. Director Cartwright, he began, his voice steady, the tremor gone from his hand. For the past 6 weeks, I have been the subject of a deliberate, sophisticated pharmacological assault designed to induce symptoms of a neurological disorder. He laid out his personal medical data, the lab report on the original patch. The perpetrator required intimate knowledge of neurology, access to my person, and a clear professional motive. Olivia's face was a mask of shock. Aris, this is horrifying. Who would do such a thing? He continued, ignoring her. I identified the delivery mechanism and the likely suspect. To obtain definitive proof, I initiated a controlled diagnostic procedure. He turned his laptop to show the camera footage of her first intrusion. Olivia's blood drained from her face. This footage shows an authorized entry but not the act. So, I introduced a diagnostic agent. He opened an audio file. The sound was crystal clear, transmitted from the patch on her own skin from the night before. Her own voice, whispering to herself in his office. Just a little more. The old fool is practically writing his own resignation letter. A few more days of this aphasia and the board will push him out. Then it's mine. All mine. Stupid man, trusting me. The room was silent. Olivia stared, frozen, the truth broadcasting from her own body. Aris delivered the final, clinical blow. The vial you handled in my desk contained a harmless dye marker. You will find your fingertips, and likely your system, are now stained with a compound visible only under UV light. The ethics office has a scanner. Helen Cartwright looked at Olivia, her gaze like granite. Dr. Finch, your access to this clinic is revoked, effective immediately. Security is outside. You will accompany them to be scanned, and then to answer the questions of the police. Olivia was led away, not with a struggle, but in a silent, stunned collapse. Aris Thorne stood by his office window later, watching the London rain cleanse the streets. The phantom scents and symptoms were gone. The data, once again, reflected reality. But the truth he had diagnosed left a hollow space where trust had been. He had cured himself, not of a disease, but of a malignant presence. The practice of medicine, he understood now, could be a battlefield, and the most dangerous pathologies were not always found in the tissue, but in the human heart. He adjusted his clean, white coat, a new one, and went back to his patients. The uninvited one had been discharged. For good.